Katie Ross, and I am with Gallagher. So Renee from County Health Pool is going to go ahead and get started, and then I'll come back for some information, and then Jim from Aflac is with me as well, and then he will go ahead and take over. So thank you for joining us.
Okay, well, good afternoon. Hopefully you guys can hear me too. But I'm just going to start off with, kind of explaining that you guys are obviously in your open enrollment period. So if you want to make any plan changes, jumping from one plan to another, adding people, dropping people, you can do that kind of no questions asked right now. It'll just go into effect, realize, not until January of next year. So as far as the plans are concerned, nothing has really changed. We still have medical and dental through Anthem, and our vision is still through VSP, so all of that is staying the same. And then we just kind of show you what your overall increase is, just to kind of understand where everything is coming from. The County Health Pool took a 5.5% increase overall, but some groups took a little bit larger, and a lot of that has to do with when we're looking at what your loss ratio is and what the stop-loss insurance claims that you guys might have. And because everybody's in a different band, we kind of move people around if you do have a higher loss ratio, and that's why overall you guys had a 7.5% increase. But as far as the medical plans are concerned, nothing is changing there. Your deductibles, just as a reminder, do start over as of January 1st. So that's just something people sometimes forget about as well. But as far as the plans are concerned, there's nothing changing. But if you do have medical, everyone will be getting a new ID card for January 1st. The reason being is Anthem is actually bringing all of their RX in-house, but not until 2020. So Express Scripts will still be used for 2019, but as of 2020, Anthem is actually going to run all of the RX prescriptions and things like that. So there's a couple of numbers that are going to be changing on your ID card, but my understanding is it'll still work exactly the same. So if you go to mail order or you do a retail pharmacy, just because those numbers are changing, you should still be able to get those claims processed. There's two different medical plans you guys offer. The first one is the B1000, and what that is a PPO plan where you've got a $1,000 deductible for an individual and up to $2,000 for the family. Your out-of-pocket expenses are $42.50 for an individual, or just going to a doctor's office visit or anything like that. Those are $35 copays. Your preventative care services, though, are still paid for at 100%. But if you're going to like a specialty doctor or like this list, chiropractor and acupuncture, those are $35 copays as well. Just realize with chiropractor and acupuncture specifically, they do have a limit of 30 visits for each one. So you just want to make sure to keep track of those if you do go quite frequently. But as far as inpatient, outpatient hospitalization, any lab work, x-rays, emergency room, any ambulance services, all of those are pretty much stating 80-20 after deductible. So you just have to pay that first $1,000 of your deductible, and then you're going to pay 20% of whatever those costs are until you reach your out-of-pocket maximum. I know you guys don't have urgent cares up there, but if you were ever traveling and needed to be seen by somebody, your urgent care copays are the exact same amount as just your regular doctor's office visit. And then as far as the prescriptions are concerned, there's no real changes there, but just a reminder that you do have a separate $75 deductible at the beginning of the year. So a lot of people tend to forget that and think that first prescription that they get, all of a sudden the price jumped up. But as far as the retail and mail order, they're still the same copays, so you have the choice between doing either one for that. So the other medical plan is very, very similar. Really the only difference between the one that I just showed you and the B2000 is the deductible and the out-of-pocket. So with this plan, as an individual, you're paying the first $2,000, and then for the family, you're paying up to $4,000. And for your out-of-pocket maximums, it's a maximum of $5,250 per person, or up to $12,000 for the family. But as far as your office visits, those are still the same at $35. Your preventative care services are still paid for at 100%. Same thing is similar for your inpatient, outpatient hospitalizations, lab work, x-rays, all of that kind of stuff. They're all 80-20. Just a reminder, though, that the deductible is you're paying the first $2,000 of any of those costs instead of the other plan you're paying the first $1,000. And then the prescriptions, all of those are the same too. So you'll generally just have your co-pays if you're going to the retail pharmacy or through the mail order, and that does still have a $25 deductible on that plan as well for that initial first prescription you get at the beginning of the year. Dental plans, there's not really any changes. Again, they have their separate deductibles depending on what kind of services you're having done. So you do have those deductibles, but those are still the same. There was only a change actually this year. If you were on dental coverage, you should have gotten a new ID card at the beginning of the year because the network actually changed to what's called Dental Complete. So you'll notice on your ID cards that it used to say PPO Plus, where now it should say Dental Complete on your ID cards because some of the numbers on our side had to change because of that. But as far as the plans are concerned, everything still has remained the same. So you have your $50 deductible per person on the plan, up to $150 if you've got family coverage. Everyone has an annual calendar year maximum of $1,500. If I'm just going in to get like my teeth cleaned or anything like that, those are generally all paid for at 100%. Any other kind of services that fall under general, restorative, those are paid at 80%, as well as oral surgery services. The only difference where it drops is under prosthodontics that are dealing with crowns and dentures. Those are paid at 50%. And under orthodontic services, now those are only for your children, but it will pay up to $1,000 lifetime maximum per child that does have to have any kind of braces. Another unique benefit for us, if you haven't dealt with it, is for your wisdom teeth. If they're impacted, it actually gets processed through your medical insurance and not under your dental. So if they're not impacted, it would just be a normal dental claim. But if they are impacted, the dentists actually have to submit them through medical. So it's probably one of the biggest claims we ever have issues with. So if you ever do, please let us know, because a lot of dentists actually can't process those claims through medical. So a lot of times we have to help get those processed correctly. So then you would be responsible for whatever medical plan, deductibles, and out-of-pocket maximums on those for the impacted wisdom teeth. Vision is probably the biggest change. The network itself, as far as the providers, isn't changing. It's more the name and some of the benefits. Currently, we're on the VSP Signature Plan, and as of January, it's changing over to the VSP Choice Plan. As far as your exams, those are still paid for $15. You have a $15 copay as long as you do it once every 12 months. For a very basic lens, those are still $15 every 12 months. It's when you get down to frames and contact lenses, your current allowance is $120, where now it's going to jump up to $150. Just realize, though, your frames, you can only do that once every 24 months. The contact lenses, you can actually do every 12 months, but it is in lieu of the frames. So if you're wearing contacts and glasses, you can kind of jump back and forth and still potentially use that $150 every year, but you just can't use it for both in the same year. The laser vision correction discounts, those have not changed, so those still give you those discounts. It's also when you get to your lens enhancements, it talks about progressive lenses and gives you different rates on those, and other type of lens enhancements. If you need anti-reflective coating or things, then that gives you anywhere from a 20 to a 25% discount on those. Also, if you need additional glasses, you can get an additional 20% off of those. Or if you want prescription sunglasses, you can get a discount on those as well. Your life insurance, all of that has stayed the same. So you still have your $20,000 as a full-time employee for basic life and ED&D. You can also pick up supplemental life insurance for yourself or your spouse. As an employee, you do have to have twice as much as your spouse does. You can max out up to $300,000, and your spouse can pick up to $100,000. If you didn't do it as a new employee with their guaranteed interest amounts, then you can always pick that up actually anytime throughout the year, but there is a health statement allowed. With the life insurance, there's also a couple of free services. The first one is the Resource Advisor, and that gives you up to 3 visits with a counselor for any kind of emotional, legal, or financial support. There's also a travel assistance program, so in the event you're more than 100 miles away from home and something were to happen to somebody, and you need help getting people back home or any kind of medical facility issues or anything like that, that program can actually help you guys with that. As far as the Anthem website, if you use it, you've probably noticed a drastic change to the website. When you actually log in, this is kind of what your main page will look like. And about halfway down, you'll see how it says most recent claims. So you can actually view all of your claims in there. If you get them by paper, you can continue to get them by paper. But if you ever want to go and print any of them, the claims are actually all by date. So they're pretty much in chronological order. There's a plus sign next to each one. So if you hit that plus sign, it'll actually open up and show you a little bit more detail of the claim. And if you can kind of see on the bottom right-hand side in blue, it says that's where you can view or print your EOB. And I know Katie will kind of get into that a little bit more in detail, how if you need to print any of those out to get paid back for any of that. There's also, if you're used to what was called Find a Doctor, it's now called the Care and Cost Finder. You can actually go to that page. It kind of has like some basic helpful links you can just click on. Realize though, if you are logged in, it is defaulting to whatever your home zip code is. So if you needed to look for a provider in Denver, you're going to have to, when you get to the search options, go in and change that address to find them. But once the list of providers is there, it'll actually give you like their names and addresses, phone numbers. It also has the estimated cost, obviously, for like a basic office visit kind of thing. But if I was looking at MRIs or x-rays for certain things, it'll give me those roughly estimated costs, as well as how much I would be expecting to pay for those services. So you could actually kind of compare different providers to see the differences in prices between them. Some other benefit options that it has on the website too is it also lets you look at your deductibles and out-of-pocket. So it'll let you see how much you've actually paid towards any of those services and how close you are to maxing out your either deductible and or your out-of-pocket costs. There's also another option of what's called service limits. And what that is for services where there is a limit, like I talked about, the chiropractor and acupuncture only have 30 visits. There's a whole list. This just shows you a few, but there's a whole list that shows you all different options. And it'll also tell you how many of those you've actually used and how many you still have left to use for that calendar year. Also, if you need a new ID card, you can go to Anthem's website. You can call the 1-800 number. On the website, there's a button to request the ID. You can print off a copy if you need it desperately. Anthem does also have a service if you have a smartphone, and you can download their app. So if you hate carrying around ID cards or you always lose your ID card, you can download their Anthem app. You do have to log into it just like you do on the web page, but you can actually view a copy of the front and back of your ID card, so you can always have it with you. You can also look at your claims and pretty much all of that same information that I just showed you. You can see all of that on the app as well. Anthem also has another program. It's called Live Health Online. We showed you guys probably the last year or two just a very basic service. They now have a version that is more geared towards your children. So if you actually want to visit with a pediatrician, it gives you those options now. What the service is kind of like I'm Skyping or I'm FaceTiming, so you do have to have a webcam or a smartphone where you could actually visually see that person face-to-face, and you log into your account, you set up the Live Health Online, and you can actually talk to those doctors. They can prescribe prescriptions and everything like that if you need any of that. Your copays are actually the same as what your normal office visit would be on the PPO plan, and I have been told if they, after you kind of explain the situation and they say, sorry, we can't help you, you're going to have to go to the emergency room or something, that I have been told that they actually won't charge you for those visits either. So, as well as just going to speak with a doctor, and one thing to realize, it's not going to be your local doctors. It could be somebody in California, it could be someone in Denver, so the likelihood you would actually talk to any of your local doctors is probably very unlikely. But there's also a psychology version as well. So if I just want to sit at home in my pajamas and talk to a therapist, I can do that by FaceTiming them through this program as well, and there are just flat rates for those services too. Some other reminders for you guys, if you are Medicare eligible, Medicare for us will always be secondary, so if you want your Medicare to be primary, it probably doesn't necessarily benefit you to have the county health pooled insurance unless you do need to cover other dependents or spouses or things like that. We also try to encourage people who have Medicaid for either yourself or any of your children, dependents, that you at least check maybe every 60 days roughly to make sure you actually still have that coverage. We honestly have a handful of people every year that don't realize that Medicaid dropped them, and until they go to the doctor and say, hey, the doctor dropped me back in July. So there's a lot of different ways that you can check up on it, because you realize, just like other family status changes that I'll talk about in a second, you only have 60 days from the date you lost your Medicaid coverage or your dependents lost the Medicaid coverage to be able to be added onto ours. Some other reminders of those qualifying events that I talked about. You can make changes throughout the middle of the year if you have a qualifying event, which means I got married, I got divorced, if I'm in a common law domestic partnership, if I had a baby, adopted a baby. There are certificates and things like court documents we might need to prove all of this, but just realize you only have 31 days from the date that event occurred to make sure we know. So you want to make sure you're getting those updates to Whitney as quickly as possible, and even if you don't have the birth certificate right away, at least getting applications turned in or online that they'll explain to you here in a second, so that we have all of those changes in our system so that people can get added or dropped. Some other reminders that people do tend to forget, like beneficiary changes, especially when people are getting married or divorced or have a baby, or if you've been with the county for the last 20 years and you haven't updated your beneficiary information, you want to make sure that you're doing that. I told them this morning about a case we're dealing with currently where an employee at another county had been married years ago and had gotten divorced, remarried a few years later, added her new spouse onto her health insurance coverage, but never updated any of her beneficiary information, and unfortunately passed away about a month ago. And you guessed it, the ex-spouse is actually the beneficiary of her life insurance plan with us. And that's something we can't change, so you do just want to make sure you are updating all of that kind of information. Same thing with name changes. If you're getting married or divorced, we do have to have a copy of a driver's license or social security card in order to make those name changes. I kind of talked about the divorce and the marriage. Same thing with address changes. If people move, people will ask us for new ID cards. We'll get them sent out. They'll say they never got them, and it's because we have a bad address for you guys. Just kind of remembering all of those different kinds of changes that can occur and keeping everything up to date. This just has the who to call numbers. Your Anthem numbers are on the back of your ID card. VSP, you don't have ID cards. That's all run through by the primary person's social security number, but you can actually log into VSP's website with your employer information, and you can see as far as when you're eligible for different benefits, and there is actually a place you can print a copy of an ID card if you really wanted one.
All right, thank you, Renee. I really appreciate it. So this is Katie Roth again, and I'm going to go ahead and take over from here. So the county is going to cover 75% of the cost of your coverage, and if you choose the B2000 plan that Renee spoke about, in addition, you receive a contribution to a health reimbursement account that you can use to pay for some of your out-of-pocket expenses, and that's for medical, dental, and vision for 2019. And for dental insurance, if you're a full-time employee, the county will contribute 75% to the total cost of dental as well. Vision is remaining the same as it is currently, and the county covers 100% of those premiums. As Renee mentioned, you have a $20,000 life insurance paid for by the county, and you are able to pick up supplemental life insurance in addition to that. Just a reminder that all plans are standalone, which means you can choose medical without taking dental and vision, vice versa, whatever works best for you and your family. And all premiums are deducted on a pre-tax basis, so that does reduce your taxable income. As I mentioned, if you choose the B2000 plan, you will receive a health reimbursement account, and you can see the contributions depending on how you enroll in coverage. It will continue to be administered by WageWorks, and the claims must be incurred between January and December of 2019, but you do have a 3-month grace period to submit them to WageWorks. Flexible spending accounts are still an option for you as well. So we have the health care and the dependent care. The health care is there to pay for medical, dental, and vision out-of-pocket expenses that you have during 2019, and that's for you and your dependents. A dependent care spending account is strictly there to cover daycare expenses for children under 13 or adults that you may be responsible for. The basics on the flexible spending account, you will go ahead and enroll online via your new online system, and you will be able to elect the amount that you want to contribute. Just a note, the maximum for 2018 is $2,650 in healthcare, and dependent care is $5,000. And you're probably thinking, I thought we were talking about 19, not 18, and we are. However, the IRS has not released the 2019 maximum amount, so for right now, we need to go with the 18 ones for your enrollment. And anything you elect is for the full 2019 calendar year. You are not able to change your election mid-year, so just make sure that you budget correctly on what you think you might use. Anything not used will be forfeited. However, you do have 2.5 months after the end of the plan year to submit your request for a reimbursement. As I mentioned, your election is locked in for the entire year. The only exception is if you have a change in status, a life event. So I got married, I got divorced, I had a baby. All those amounts, during all of those time periods, you are able to adjust your election amount, but that is the only time. You do have a debit card that you are able to use for these accounts. In addition, you can file claims directly with WageWorks by mail, fax, or online. They will automatically reimburse you via check. However, you do have the option to set up direct deposit with them if you'd like. So the county is still providing you with a long-term disability plan. They provide 60% of your salary, up to $5,000 per month. This is if you become ill and are unable to work for more than 90 days, and that is through Lincoln. In addition, the county provides all employees with the access to an employee assistance program. You receive up to 4 sessions per person, per issue, per year. And I let the group know this morning that that is a higher benefit than we normally see. So that's a really good benefit for you. And it will provide you with assistance on legal, financial, work-life. You also can get a discount with lawyers, a 25% discount if you need any legal services. So I would definitely encourage you to take advantage of the benefits. And so Jim is right here with me, and he is going to go ahead and talk about Aflac with you.
Hi, gang. As Katie said, my name's Jim. It's Jim Garner. I've been with Aflac for 13 years. And what I'm going to do is probably take about 5 to 8 minutes and run you through the plans that are being offered to you. And the biggest thing I want you to think about while we're talking is, what is your plan to pay your bills? If you get sick, hurt, can't go to work for a week, a month, 6 months, what's the plan to get the bills paid? Because that's where we come in. Now, as Katie just said, you do have a long-term disability plan that kicks in at 90 days. That's going to pay a portion of your income. But what about that first 90 days? That's where our short-term disability plan would come in to fill in that gap. So what that is ensuring your paycheck. So if you as the employee get hurt, get sick, can't go to work, that's going to kick in and pay you a portion of your income while you're out of work. Second policy I'll talk to you about is our accident plan. This is you, it can be your children, your spouse. Anybody gets hurt on the job, off the job, 24/7, you have money coming in based on your treatment. So if you happen to have that car accident, slip and fall, your child breaks an arm, whatever the case may be, there's benefits for your ambulance ride, benefits for your trip to the emergency room, benefits for surgeries to put the bones back together. If you have to spend a night in the hospital, it's going to pay you $1,500 direct deposited to you for that first night in the hospital. Then it's going to pay $300 every day you're in the hospital for up to 1 year. So if you did have something catastrophic happen, that's $9,000 a month that you have coming in. And again, that can be you, spouse, or the children on that plan. Next one I'll talk to you about is our cancer plan. If you or anybody in the family that's covered is diagnosed with cancer, you have money coming in as you go through your treatment. My best friend just finished up about 18 months of treatment. There was a benefit for his initial diagnosis, benefit for his hospitalization, surgeries, travel expenses. He went down to MD Anderson in Houston where he got his treatment because it was a very rare form of cancer. But basically, Aflac pays you cash as you go through your treatment. In my friend's case, over that 18 months, he was paid well over $100,000. And they used that money, they had good insurance, just like you guys do, but they used that money to pay the mortgage. They used that money to buy groceries and fill in the copays and deductibles. So that's our cancer plan, and it also has a critical illness component on it. The last one, again, you guys have great health insurance, but this one is designed to fill in those deductibles. It's our hospital plan. And if you have to spend a night in the hospital, it pays you a lump sum for your first night in the hospital. And then there's also wellness visits on there, trips to the doctor. So for those of you with families, the trips to the doctor, that sort of thing, it's paying you cash for each trip. Biggest thing to remember on all the things that we talk about is all the money's paid directly to you. The health insurance paying the docs and the hospitals, and all the Aflac money is direct deposited to you. Pay the rent, the mortgage, the car payment, groceries, keep the lights on. So we are going to FedEx you today or tomorrow to your HR department. We're going to FedEx you enrollment forms where you can fill out your interest sheets. Please have those back to HR by November 16th. And then after that, Katie's going to coordinate a couple days up there face-to-face, I believe. And then also we're going to have phone enrollments available as well. And I think I covered everything on that.
Yeah, thank you, Jim. So everyone, just a reminder for the enrollment, make sure that you complete your online enrollment no later than November 16th. And it's very important that you will need to elect all benefits online this year. So, and remember, whatever you decide is going to remain in effect for the entire year of 2019, and unless you incur a change in status, and then you would be able to make changes. If you do experience a change in status, you want to make sure that you notify Whitney within 31 days so she can provide you with the instructions on how to make that change online. Any questions for us here?
Everyone's kind of shaking their head no.
Wow, well I guess we learned from this morning and we knew to cut them through as we went. Well, great. Well, Whitney, as I said this morning, if you have any questions or anything comes up after the meeting, you know where to find us, and we're really happy to help with anything.
Awesome. Thank you so much.
Yes, thank you all. Have a great day.
Right. So there are some changes this year, as they have been alluding to over the course of this call. We are doing online enrollment this year, so that is huge. As of this afternoon, the first component of our human capital management software that the commissioners approved roughly 6 weeks ago is coming online. So that is our iHire component. As of this afternoon, every job for Lake County government that is posted and is currently open or will be open in the future will have all online applications. So if for some reason someone does not have a computer to apply for a job, we are directing them over to the Workforce Center for them to assist them in applying for our positions. But as of this afternoon, all of our positions for Lake County government will have an online application built in for them. So that is the first component of it. The second component of it is our onboarding system. So that comes live and on the system Monday. So we wanted to go ahead and get you out what the healthcare rates were going to be this afternoon. The session for today was taped so that we can digitalize that, get that onto a YouTube link for the individuals who weren't able to attend the morning or the afternoon session. Or if you guys have questions about anything that the reps this afternoon might have said. You can go back to that video and reference what they had said in the slides. We'll also provide a copy of the slideshow that they presented today on that link. We are going to have a calendar out there on the email this afternoon that lists all of the times I'm available the next 2 weeks to help everyone with this new process. So because this is a new system for Lake County government, no one is built into it yet. So we'll be building the shell of it over the weekend and loading in all of our employees that are benefits eligible. So at least they'll have your social security number, some of that basic information that we have in the system for you. We're going to be going in and asking you to capture all of the rest of that information, kind of like you were a new employee. As we have been doing the process of digitalizing our human resources records and all of the documents that we consider to be human capital management, we've found that we don't necessarily have the most current information for you guys. So we want to make sure that as they were referencing beneficiaries, emergency contacts, your addresses, that we really do have the most accurate information for you guys. So you'll be kind of onboarding through the system as a new employee. And then as you get through to the end of it, it's going to ask you to select your benefits enrollment. So you'll have the option to select your medical plans. It's going to pull up the plans in there so that you can see all of the information simultaneously. You can change what plan you're in. You can decline having medical coverage, or you can say that you don't want any changes this year at all. If you have any questions about the current plan that you're on, reach out to my office so we can let you know what plan you're currently under, and the commissioners will also have a copy of that list if for some reason I'm not available. So that's that kind of portion of it. As I said, there'll be time set aside the next 2 weeks that if anyone is struggling to do it, we will be able to sit down and walk you guys through that. The company that we went with, iSolved, they're producing webinars for us. So a component of what will be out there for you guys is those online tutorial videos. If you get stuck on any of the screens or any of the components where you can kind of watch any of the segments on it, as well as having their question and answer guide out there. But this is all in an effort to make documentation and information more accessible to you guys as the employees. So by January 1st, we'll bring the last of the components online. So we'll be doing online timekeeping as well as a new payroll system. And so all of these components will all integrate into one system for you guys. So when you go into your iSolved logon, you'll be able to see your accrued balances for vacation, sick, the personal time. You can do vacation requests. The people on PubWorks are going to be slightly different. So you'll still log your time into PubWorks, but then we'll get a data feed every 2 weeks from them. So it will show a new updated balance for you guys every 2 weeks in there as far as your sick time and stuff like that. But you guys will still be able to do all of the time off requests and stuff, and that will load automatically to your supervisors within the system. So they'll be able to see if there's conflicting time off requests, if you in theory have enough time at the time that you're requesting time off, because a lot of times we'll get that calendar at the beginning of the year and we're writing requests off for August or September or November of the following year. The system will auto calculate for your supervisors based on what you've already requested, if in theory you'll have enough time at that point to take off like a 3-week vacation or something if you're putting extended time in.
And then, I'm sorry, this is through the IP and not Public Works?
Correct.
Okay.
Yep.
But either way, they're gonna get the information.
Correct. So the thing that will stay the same for you in Public Works is that's where you'll be doing your time card. Everyone else right now has been doing paper time cards, and so they're just getting a new electronic system. So instead of making you guys migrate away from what you guys are already comfortable with as far as the Public Works units, road and bridge,
And it
landfill,
tracks
airport.
our equipment and everything, so.
Yeah, we're keeping you guys on that system, and we're just gonna take a data feed into it. But all of the other components of iSolved, you guys will still be able to see. So by us bringing the new payroll component online, all of your payroll stubs, your W-2s, all of that stuff will be electronic. You'll have access to all of your information through the iSolved app. So if you're at a car dealership on a Saturday and you're trying to get pre-approved for a car loan, you'll be able to pull all of that stuff up in the app and email it directly to the dealer that's working with you, so that you're not having to kind of delay some of that processing for loan applications or doing your taxes or any of that fun stuff. As I said, this is all external link, so everything is managed through the iSolve system, so you can access this from the comfort of your home, which is, I think, is another big benefit. So with the benefits enrollment coming online Monday, you guys will really be able to sit down with your families, have those conversations of what the benefits packages look like. Does it make more sense for you to be on theirs, them to be on you, who's covering what kids, those sort of things. Instead of you having a bunch of paper in front of you, you can really make those real-time decisions online with all of the information available to you guys. So it is a big, scary, huge jump for Lake County government, because we are going from everything being paper to everything being digital. But by next year, everyone is going to be old pros at this, and it won't be bad at all. One of the other benefits of the system, as they were referencing in the call, with the issues that other counties have been having, keeping information up to date, this new system really puts that in your guys' hands. And so with your access to iSolved, you can go in at any time and update your address. You can update your beneficiaries. You can update your emergency contacts. You can file a new W-4 if you have a tax withholding change that needs to be made. It puts that stuff at your fingertips so that you can make that decision at 7 o'clock on a Saturday night and have it in the system, and it's automatically live on our end. Same with you having any dependent changes. So if you have a life changing event for the medical plans or dental vision, all of that stuff can be done electronically now through the new system.
So if through that program, will it automatically download a pay stub? And will it give a notification that your W-2's ready? And
Yeah, so this year they're gonna process, I think the plan still is to paper process the W-2s out for 2018, so you'll get a paper W-2 like you have in years past. In 19, everything will be electronic, so you can download the PDF and upload it directly to an online filing. If you're doing your taxes yourself, you can download that PDF and provide it to a tax provider if they're preparing your taxes for you. But it really kind of gives you the ability to decide how you want to manage that paper in your life. What we've been finding with the direct deposit pay stubs is most people get those lovely magenta stubs in the envelopes, and then those envelopes all get shoved in the center console of a car or in a file cabinet or whatever, and then you start going back and trying to look for all of them, and you're missing 3 or 4. And so instead of you having to contact us to get copies of those things, it's right there. If you need that pay stub, print it. If you don't need it, it's there for you to have access to in perpetuity, which is the nice thing about this system. So as you're onboarding, it's going to ask you for an external email address. If at any time you leave Lake County government, you can access those records through that email address that you provided. Even if you forget your password, it'll send you that whole password reset to that Gmail, Yahoo, whatever you designate within the system. So now we'll be able to produce and send out all notifications, reminders, flyers for the county. All of that stuff is going to go out onto that iSolve system. So it's going to operate as our internal county website. We'll be able to make announcements, recognize and do recognitions out there. All of those components will all kind of now seamlessly integrate into one system. So, this afternoon or this evening, depending on how long it takes YouTube to load up our video this afternoon, we will send out an email that will have all of the plan sheets attached to it, the schedule of when I'll be available the next 2 weeks to help you guys walk through the process if you were stuck. the information regarding what to expect Monday. And then Monday's emails that you will receive are going to have your logon information, so how you're going to access all of your individual accounts, as well as all of those instructions on how to go forth. Questions, concerns?
Now, it's gonna be sent through the government email system or personal email? So let's say for the landfill, you're dealing with 6 people.
Right. So the plan that we had come up with this morning is Brad, Michael, and Mabel are going to get a list of all of the public works staff's logon information.
Okay.
So if for some reason like airport and you guys have kind of that mass email box, they will give you what your individual logons are,
Okay.
so that they're not sending an email out with everyone's stuff in one group. So we're gonna kind of let the departments manage that for some of the weird ones. Not that you guys are weird,
Yeah,
but I guess I should say non-standardized forms of email distribution. All of our departments that have their own unique email addresses, they're gonna go to theirs. So for example, Human Services, they run off of a state email server as opposed to having the Lake County email addresses.
Okay.
So theirs will be corresponded to theirs. Same with the library, they run off of having a library specific email address. Those employees will get it both to their county and to their library email. Thoughts, concerns? Okay, so there'll be multiple people who have access to this. The commissioners are all gonna get the information as well to assist individuals in setting stuff up. There's the online tutorials and webinars, and there are question sheets that are all out there for the frequently asked questions. Finance has graciously offered also to be a backup resource if anyone has questions. But Lake County government is jumping forward into the 21st century, so I ask you to bear with us. It's going to be a fun couple weeks, but once everything's up and going, I think next year you guys will be real pleased with the process improvements that we're making. Thanks. Any questions for me? Concerns? Okay. Go team.
Go team. Thanks.
Thank you guys.